Trailblazers in children's healthcare, Great Ormond Street Hospital, GOSH, has been fighting for seriously ill children for almost 2 centuries. GOSH, then known as the Hospital for Sick Children, opened its doors at 49 Great Ormond Street on Valentine's Day 1852 with 10 beds. Since then it has become one of the world's leading children's hospitals and the home of vital advances in paediatric medicine and care, the impact of which has reverberated across both the UK and the globe. The hospital is born. Great Ormond Street Hospital was founded by Dr. Charles West, who was driven by the shockingly high level of infant mortality in London. It was the first hospital in the UK dedicated solely to the treatment of children. GOSH started life in a 17th-century townhouse with just 10 beds and 2 physicians. Since then, the hospital has been in a constant state of redevelopment to update aging wards and enable us to provide increasingly innovative treatment. This includes the pioneering Zayed Centre for Research into Rare Disease in Children, which was completed in 2019. Read about some of our other redevelopment highlights. Breakthroughs and innovations. GOSH has been at the forefront of countless innovations, from developing nursing training in the late 19th century and opening the UK's first leukemia research unit in the 1960s, through to today's breakthroughs in gene therapy and its pivotal role in the national management of COVID-19. Here's a snapshot of some of our breakthroughs and firsts. 1928, GOSH appoints Dennis Brown, the UK's first consultant paediatric surgeon. 1934, GOSH was the first hospital in the UK to obtain the drinker respirator, also known as an iron lung, to treat polio. This device helped to expand children's lungs, allowing them to breathe and providing an alternative to frequent surgery. It was subsequently loaned out to other hospitals. 1947, the hospital's heart and lung unit opens, the first of its kind in the UK. 1950s, Richard Bonham Carter and David Waterson established the GOSH Thoracic Unit, the UK's first joint medical and surgical ward devoted to diagnosis and treatment of children with chest and heart diseases. 1959, the UK's first children's neuroscience unit is established at GOSH under neurosurgeon Kenneth Till's lead. Thanks to Till's commitment, children with brain tumours, lesions, severe epilepsy or hydrocephalus could receive life-saving surgical care for the first time. 1961, the UK's first leukemia research unit opens at GOSH. 1962, the hospital pioneers the first heart and lung bypass machine for children to help repair heart problems. By 1967, 60% of infants with severe heart and lung problems were surviving. 1970s, GOSH immunologist Professor Roland Levinsky develops a technique to isolate vital immune cells in the blood, extracting working immune cells from a healthy donor and transplanting them into a child. 1977, Billy Butlin helps to raise funds to purchase the UK's first paediatric CT scanner, and GOSH is the first in the UK to have its own CT scanner suite, opened by the Queen in 1977. 1979, Professor Levinsky carries out the UK's first successful bone marrow transplant in a child. 1988, Professor Mark de Leavell sets up the transplant unit at GOSH thanks to a £200,000 fundraising appeal. It's one of the first centres in the UK to carry out life-saving transplants on children with heart failure. Today the programme is one of the largest in the world, performing around 20 heart and lung transplants a year. 1992, GOSH researchers help identify the first genetic cause of life-threatening immune diseases. 1998, Great Ormond Street Hospital Children's Charity becomes a separate legal entity from the hospital. 1999, Dr. Paul Vase develops a kinder bone marrow transplant with less intense chemotherapy, helping children too sick for standard doses of drugs. 2000, world's first gene therapy trials begin for children with severe combined immunodeficiency syndromes. 2001, immunologists Professor Bobby Gasper and Professor Adrian Thrasher spark a groundbreaking program of research into gene therapy, a technique where a faulty section of DNA, a gene, is replaced with a working copy. The team began a trial that would become the second ever successful trial of gene therapy for any disease anywhere in the world. 2010, GOSH undertakes the world's first stem cell-supported tracheal transplant in a child. 2012, the hospital opens Europe's first research center to tackle birth defects, the New Life Birth Defects Research Center. 2015, GOSH immunologist Professor Wasim Kassim uses CAR T-cells to treat a 1-year-old patient with incurable leukemia. His incredible world first sparks a new wave of CAR T-cell research around the world. 2018, GOSH and University College London Hospital conduct the UK's first pioneering surgery to help reduce the long-term symptoms of spina bifida, operating on a baby while still in the womb.